again, and today we are going to be talking to Glenn Falk, and he is a professional guardian. So today's topic is really going to be dealing with guardianships and what all that means. So Glenn, why don't you introduce yourself?
Yes, I'm Glenn Falk, proud professional guardian, starting Guardianship in 2010. I worked for about 3 years for the company and then went private after that.
So tell everybody, I think there's some confusion. We hear a lot of terms about power of attorney.
Right.
We hear guardianship thrown around. Can you kind of give us an overview of what a guardian is?
Sure.
And then we'll go into how that differs from a power of attorney.
Okay. Guardianship is court appointed, typically it's appointed by the probate court or the county court. And that is once they've exhausted any less restrictive alternatives. If maybe individuals got some dementia, they're just maybe not handling their money quite well, they look at money management. If that's an alternative to full guardianship. But guardianship is typically whenever someone has become incapacitated. It can be guardian of the person only, which is deals with their well-being and health, or it can be guardian of the estate, which deals with their financial matters, or you could be guardian of the person and estate.
Okay, I think one of the things that I always try and talk to families and patients about, the easiest way for me to kind of conceptualize or think about guardianships is that to have a guardian, a person has to have been declared incompetent
Yes, ma'am.
by a judge.
Right.
So a medical doctor can't do that. They can give input to the judge, but the
Exactly.
judge declares that. Then the judge appoints a guardian or a person to make decisions for that person.
Right.
And one of the big things that I think people often confuse is power of attorney in guardianship.
Yes.
So do you want to talk about what you think are the main differences between those?
Sure.
And then I'll kind of talk about what I think it is
Sure.
from the physician or provider standpoint.
Okay. Power of attorney is set up whenever the individual still typically has capacity and they've elected to have someone who makes decisions for them, whether it be in their financial matters or their health and well-being. That can be revoked at any point. That individual just says, I don't want that power of attorney any longer. The guardianship, again, is appointed by the court, and the only way that that guardianship is dissolved is for the judge to hold a hearing again and decide that that guardianship needs to be dissolved. Many times because there are situations where an individual had incapacity at a point but has regained capacity, and at that point the guardianship can be closed. Sometimes they may not have regained full capacity, but they have regained the ability to make some decision for themselves. So we can go to a partial guardianship. And that again is only closed or changed by the court versus a power of attorney, which is a decision made by the individual that the power of attorney is over.
Right. And I think from the medical standpoint of how providers deal with it and look at it, some of the big differences between power of attorney and guardianship is with a power of attorney, the power of attorney is someone that has supposedly talked to that individual, knows what their wishes are, what their desires are, and they speak for that person when that person can no longer speak for themselves. So they're in a coma, they're in surgery, and the surgeon comes out to ask you about a decision that needs to be made while they're under anesthesia. But it's not because the person don't have the cognitive capacity to make the decision. It's because they're incapable. They were in an accident, something happened, they can't speak for themselves. That power of attorney is supposed to make decisions in line with what they know the patient to want.
Yes.
Whereas a guardian is someone who is appointed because that person, it's not that they can't speak or they can't make their wishes known, it's that the court has deemed that that person doesn't have the ability to make informed decisions or decisions based on information. And one of the examples I always use with a lot of people is smoking. So a lot of people are aware that smoking is bad for your health, it's an expensive habit, but they make that decision knowing the risk, knowing it can cause lung cancer. They make the decision and the choice to smoke, but they knew what the risks were.
Right.
Whereas a small child, a 5-year-old, wouldn't understand the risk or know what they were, so they can't make that an intelligent decision to make that choice. So I always use that to say, if you have the ability or the intellect to be able to make a bad choice, you can make a bad choice. But if you don't have that capacity, if you don't have the capabilities, the intellectual capability, and this generally in our population, when we're talking about it, is people that have some form of dementia that has progressed, and that dementia has really caused deposits in their brain, and we will go into the whole dementia process on another talk. but it's really caused them to not be able to remember things, to be able to think clearly, or to understand necessarily what's being said to them. Therefore, the wishes that they may express aren't based on factual information necessarily, and so a judge appoints a guardian who is the person that's supposed to make those informed choices for the patient. So you aren't doing necessarily what the patient wants, but you're doing what you believe to be in the best interest. And an example I use for that is if a parent takes a 2-year-old child in to get their 2-year-old immunizations, a 2-year-old can very clearly say, I don't want that shot. They aren't realizing that they need the shot to get into school. They aren't realizing what it means to be vaccinated or how it's going to protect them. They just know that they don't want the pain that they think they're going to feel from the injection at that time. However, if the parent, who is a guardian for that child, says they're going to get the shot, then the immunizations are given, because the parent is supposed to be making informed decisions and choices for that child. It's the same thing when we get into adults who have guardians appointed for them. That person is supposed to make informed choices, not necessarily just the choices that the patient wants.
Right.
So
I think also, Laura, I'd like to make a point here. I think there's been a lot of misconception due to some social media, some Netflix segments and things like that, that all guardians are bad, that they're put there because the judge wanted to just be able to take everything away from the incapacitated individual. And that, are there bad guardians? Yes, but they're few and far between. Just like there's bad doctors, just like there's bad politicians, there's even bad garbage men. Typically, whenever someone is in need of a guardian, everything else has been exhausted. And it's not just the judge and the guardian make a decision. Typically, it comes to the attention of the court by a third party providing information to the court. The court then appoints a guardian ad litem. That individual goes out and they gather more information for the court. And they look at the situation, they look at records on the individual, they talk to the individual, and then they come back and make a recommendation to the court if they feel like there's a need of guardianship. At that point, the court appoints an attorney ad litem. The attorney ad litem's role is to go out, and if that individual can express themselves, they are to listen and hear what the individual would like. Many times they say, no, I don't want a guardian. Sometimes they are in agreement they would need some assistance. Then that attorney comes back and represents their wishes. If they can't express themselves, the attorney can't gather much information, but they still come to the court and represent them. So a hearing is held, the judge hears the guardian ad litem's information and hears the attorney ad litem's information, and then from that, formalize a decision on whether to have a guardianship or not.
So part of that process too, at some point, we talk a lot about people in post-acute care, so people in nursing homes or assisted living facilities. Sometimes a social worker or somebody else for the facility feels that the patient has lost the capacity to make informed choices. So they will notify family if there's family involved, or they will notify the court if there's no one involved to say, hey, I don't think this person is able to really represent themselves any longer. And so here in Bexar County, so we're talking about each county is a little bit different on how they work. In Bexar County, it works a little different than some other places, but we do have a county appointed system where you can turn in individuals who you believe need a guardian, and there are court appointed guardians that are out there. Glenn is a professional guardian. So we're going to talk about that too, because sometimes people have family members who are able to serve as guardians for them. And like Glenn said, you can be the guardian of the person, making decisions for the person's physical well-being, or for the financial part, for their finances and things they need, procuring things that they might need, taking care of all their bills and all of that. Or you can be both. So sometimes there's a son, a daughter, grandchildren, whatever, that might step up and say they want to be a guardian for the person, and the court will listen to the case and hear it. But sometimes some family members, either the person doesn't have any family members, so the court finds a professional guardian to be appointed for them. Or in some cases, there are some individuals where they do have family, but the family doesn't want to serve in that capacity, because granted, a lot of times the guardian isn't making the most favorable choices with the person. So typically patients with dementia, you're dealing a lot with having to tell them no on a lot of things that they want, like driving, when you have to take away the car keys. So a lot of times children or grandchildren don't want to be seen as being the bad guy or have the patient mad at them. So they opt to have a professional guardian in. And I think too, a lot of people think it's going to be something
Right.
you just sign up and you're a guardian. And tell us a little bit, it's not that easy. You're
Sure.
held to a very high
We are.
accountability record. You have to turn in receipts for everything you do. You have
Right.
records to give to the court. So why don't we go back first and tell about your training? What training do you have to be a guardian?
Typically, to be a professional guardian, which is certified by the state of Texas, you have to do a provisional under a certified guardian. That's a 2-year time frame. At the end of those 2 years doing a provisional, then you also do have to test and pass the certification test that's provided by the state of Texas. At that point, you can become certified. Every 2 years, you have to recertify. When you recertify, you have to have so many hours of continuing education to show that you are continuing to learn as much as you can about being what's going on in the best interests of these individuals. Also you did mention that you have many times there are family members that for one reason or another can't serve. You have to also understand some of these guardianships. Some of them, they've had a long history of mental illness and the families are tired. They've been abused not necessarily physically, but a lot of times emotionally, mentally by the family, the individual that needs the guardian. And so they just don't feel like they want to deal with all of that. So a professional guardian is there to take it on and to be able to help with those situations where some are very, very difficult cases. And we're there to be able to try to manage that in their best interest.
And tell them just what does the court, I can't speak today, what does the court require from you as a professional guardian?
So once a year after your appointment, on the anniversary of the appointment, you have to submit, if you're guardian of the person, you have to submit what's called an annual report. And that is a form of about 3 pages that talks about the individual, any changes to the individual, what's going on in the last year, a listing of all their doctors, their financials, things like that. Guardian of the estate, once a year there's an accounting done, and that has to show down to the penny all the finances, any changes that have gone to it, any money coming in, any money expended, receipts and everything showing that everything's being managed fiduciously for the individual.
Right, and I think, what are some things, let's move on to this, when you're dealing with your wards is what they call them, so the patients are generally called wards of the guardian. When you're dealing with your wards, what are some things that you wish medical people knew, like when you have to take them to appointments? What are kind of your top things that you wish people understood?
Right, I wish the doctors understood that there's a reason for the guardianship, and there's varying degrees. Some individuals are very high functioning, they are IDD individuals, intellectually developmentally disabled, and in a situation like that, they should have say and input into decisions. The guardian's there just to support and help guide them through that. But then we've got others who are very low functioning, who don't comprehend any of that, and the doctors want to feel like they have to be included in and make a decision when they don't comprehend any of it. So that makes it difficult at times.
I think a lot of people too, one of the things we've talked about, very few of these individuals just have dementia or intellectual disability. Most of them have substantial mental health issues, such as schizophrenia, and sometimes people can trigger some of their symptoms or make them actually worse by sort of repeating questions and it feeds into their paranoia. So what is like the best advice? Do you ever go up to staff and kind of have a motion you do or a word you say to kind of get them to move on to a different subject, or how does that work?
If I work with them, we kind of understood that, I may just, as she said, just kind of give them a look or something like that. Sometimes it just takes having to rephrase something for them to finally understand that it's best not to push the situation right now, because you may have that individual just totally refuse any kind of treatment. Not that they don't need it, not that they don't understand that might be good for them, but because whoever's trying to question them is irritating to them. So the best thing it is try to meet with the guardian, or at least a phone call to the guardian prior to, and get all the necessities that you need. When you come in to meet the individual, you need to be dealing with directly what's going on with them and not wanting to know all the history that many times is traumatizing to them.
So what would you say, give us one of your one of your favorite stories, maybe that's it. I can't say best, but one of your favorite stories of a guardian or a situation that you dealt with that you felt like.
I have a lady that she has a daughter. She and her husband divorced in the early 90s. Daughter was like 13 at the time, and they've been estranged ever since. Mother ended up being homeless on the streets here in Bexar County. The daughter lives in the Austin area. The court got notification of the possible need of guardian, and in researching, they found the daughter that was in Austin. She agreed to be temporary guardian. They didn't get along well. Mom has paranoia. She has really, in the time I work with her, I see some undiagnosed schizophrenia also. It's mild, but it's there. But a lot of paranoia. And so daughter just didn't know how to handle that. Feelings against mom because she was raised by dad, still actually living in dad's home, even though she's in her 30s by now. And so I get appointed as the guardian. When I get appointed, the daughter's gotten her off the street. She has her in a motel on a weekly basis. And so I find a very nice low-income senior community to move her into. And for the first 4 years, leading up to the time to renew the lease, about 2 months leading up to that, her paranoia really kicks in. She starts having all these delusional thoughts that she thinks is going to get her kicked out of the apartment complex. Now, she is the ideal resident there. The manager will tell her over and over. She will sit there and hear words when it's being said, but not absorb those words. She'll leave there, can't really remember what was said, and want to think the worst. Expect that the worst is going to happen. She's going to be put in jail. She's going to get kicked out of the apartment. This year, leading up to it, she had one very slight 30-minute period of paranoia about what was going to go on. Outside of that, everything was smooth and easygoing. She's on no medications. She would not take them if I could convince her to at least see a doctor and consider that. Because I did. I had her seeing a counselor. This is during the height of COVID, so we had to do it via video, and she prescribed something very mild for her. She took it a couple of days, said it made her feel funny, and got rid of it. But through a lot of direct interaction and redirecting feelings and emotions and missed thoughts, you can really make a big difference. But as a guardian, it takes that time and effort. You can't just go see them once a month. It is required by the state of Texas as a professional guardian that we see them a minimum of once a month. It doesn't say how long that has to be, but you can't go in and build a relationship, get them responding to you, to get them to understand that they need to go along with whatever you want in their best interest if you don't spend that quality time developing relationships with them.
So, and I'm sure everybody thinks like you probably make a ton of money doing this, right?
Right. No.
It's like you're definitely in it for the money because there's
Right.
a lot of money.
Right.
So let's kind of talk about that. I think everybody would be really, really shocked to learn how the money works. Most of these residents, the ones that Glenn tends to work with, like I said, have substantial mental health issues. They are low income for the most part. There probably is the opposite end of the spectrum. It's just not the patients that we typically work with. So with those lower income patients, typically they have Medicaid funding. Some have Medicare and Medicaid. So tell them a little bit how the guardian's paid.
So everything in regards to guardianship is managed by the Texas Estates Code. And in the Texas State Code, it allows, if an individual is on Medicaid, and if they have some type of an applied income, Social Security, VA, some type of retirement, then in the Texas State Code, it allows for a $250 per month commission. That would happen by the judge signing an order, which is submitted to Medicaid saying that he approves for the $250 commission to come out of the individual's applied income. Say they're in a nursing home, they get $1,000 a month. As the guardian, I can manage their funds in a guardianship account. I'm allowed to take the $250 out for commission. Another $60 comes out for their personal needs, and then the balance of that goes to the nursing home for their care. Medicaid pays the supplement because roughly $750 certainly doesn't cover a month's stay in a nursing home. If the individual is on certain types of Social Security because they've never worked, SSI, then there is no commission allowed because they get no check each month other than a $30 check from the state and a $30 check from the federal government, which is for an allowance for slight personal needs. There is still a need for guardianship. What I typically do is if I have other wards in a nursing home and I'm drawing a little commission from them, and that nursing home needs help with an individual that has no commission source, I accept that because somebody's got to help them. If they're in the community and they're on Medicaid, even if they have an applied income, that's not considered Medicaid eligible. So a guardian can't draw a commission off of someone in the community, say living in a group home or in assisted living, even though they have an applied income and they're on Medicaid. They don't allow for the commission source. The only other way that a guardian can is if that individual has an estate, and then the judge can award that to come from the funds of their estate.
So nobody is getting wealthy being a guardian. So
no, ma'am.
And Glenn, just so you know, you can tell his cowboy attire here. He is a horseman for sure. So he does halter horses. So pretty interesting there. So that's something. Do you ever get to take your residents out with the horses for any therapy
I have.
or anything?
I've taken them out some. A couple of places where they're at do that also. Actually, one of the nursing homes, they deal with many very mentally ill. They will take individuals that no other nursing home in San Antonio will take, and they understand that they have to be engaged in something constantly to make them feel good, keep down behaviors, and so they are very regularly having parties. And so on numerous occasions, I'll load up a horse, take it in just for them to hug and pet on.
That's awesome. So one of the other things that Glenn does that you see on birthdays, Christmas, special occasions,
Right.
I've seen you bring gifts to the residents. You've never let them go without recognizing a special occasion. And then I've also seen you, like, a couple residents that you bring food just because ethnically they
Yes.
don't like the food at the facility,
Right.
and so you bring a specialty food, or you'll even take some of your wards, you take
Right.
them out of
I
the
do that.
facilities to go eat and stuff. So it's a lot of it's to me it's a calling, it's a mission. It's no different than people who are called to give in other ways of themselves and share their gifts. I think it's definitely not something you get into for money. It's a hard job. You deal with sometimes patients that are very, very upset with you, sometimes family members that are very upset with you. I think everybody needs to take a step back and realize in these cases the guardians are generally, most of them are very good guardians, and they're trying to do what's in the best interest of the patient with the information that they have. And I think all too quickly people are, especially family members, are sometimes too quick to kind of jump on you guys and get after you about things that maybe they don't have the full picture about. So that's one of the things too I think y'all aren't compensated for, is all the time you spend talking to families too.
Right.
About.
You'll find families don't want to face the fact that they have incapacity in their loved one, whether it be mental illness they've had for many years, or they have lost capacity due to aging, disease, whatever it may be. And so it does get difficult. And then many times some of the family members that we have to deal with, if there's mental illness in the ward, you're going to see that sometimes in family members. And so therefore they don't understand what's going on. And it can be very difficult. With the wards, if you spend that quality time with them, they begin to understand that you really care. And it's like I tell everyone, I have a concern in the state of Texas that because there's a small commission source and many times not a commission source, you don't see young people coming out of college with a social work degree or some other degree along those lines that readily want to move into becoming a private professional guardian, because it's very difficult to make a living off of it. And as I tell people, I say, one of these days I'm going to fall flat on my face doing this, and nobody's going to be able to step over and pick it up and move on, because there's nothing that's compelling people to come into the field. And like with myself, it is truly a calling. I've got wards who have no one else. They reach out to me, they trust me, they believe in what I say to them. And as I tell people over and over and over, I went out today and I bought a lotto ticket for Saturday night. If I go in and win the lotto Saturday night, I don't give them awards. I keep them till the day they die. They become family to me, and they see me as family, so I just can't do that to them. At that point, I'll be able to pay people to do that paperwork that I don't like to do.
So what actually brought you to being a guardian? Like, how did you find out about it?
My whole life, I've worked in one field or another when it comes to working with people that need a little help. Most of my career, I worked with what most people call at-risk youth, but in my opinion, any child's at risk. So I call the kids who've gone astray as being misguided youth. And worked in it for years and years and years, never had a bad day with a child. I just got tired of a system over and over and over that really wasn't there to try to effectively change these youth's lives. Got out of it in May of '09, stayed unemployed 11 months by choice, looking for something I could go back into that would be fulfilling like that. And actually heard about a company out of Waco that had a satellite office in San Antonio. I worked for them for about 3 years and then chose to go private. At that time, one of the judges in the court's the one that suggested that I might go private, and very appreciative to her for that, because to me it truly is making a difference in people's lives.
Yeah, and one of the things here we have that's a lot different than in other places, we have had mental health judges and courts here in Bexar County, so we're kind of privileged by that, because a lot of counties, smaller counties, don't have that, and a lot of times judges in smaller counties aren't even really aware of everything that needs to be done. So sometimes when we reach out and we need assistance with somebody who needs to be transported to the hospital and the patient doesn't want to go, and we're trying to get them transported there, we kind of have to walk them through the process. So you've been there with us before when we've done that with some of the judges. So it's all about education, getting information out there, getting people to share what they know, share their resources, just so that we can take better care of these residents. So just like today's topic, just want to get it out there so everybody could start learning about guardianships, what they are, how you enact them, and what they really mean, because I think there's a lot of misconceptions out there, and so we just wanted to get some truthful information out there.
Particularly, again, with a lot of skewed information out there on social media. There's, and I can't think of the name of it right now, there's had been a series on Netflix that wanted to look at, because turmoil and looking for the bad in people is what typically sells the most, and there's been some segments on Netflix that was totally skewed, but you only hear one side of a thing. There's a lot of guardians out there that they, like myself, that they put their heart and soul into it. We put up with a lot, but we keep coming back, because those individuals that we're there for, it makes a difference to them.
Right, and I think a lot of those cases too are dealing with a different population. I think they're dealing with more the wealthier that have resources that people are fighting over, is what it comes down to. It's not really the welfare of the patient, it's typically resources that they feel like are being abused. And in our population, that's not really the issue. There aren't a lot of resources there. In fact, we try to find resources for these patients to get them the help that they need. And to that end, I know that Glenn's actually gone down to the Social Security office and spent hours before for patients trying to get ID cards when they don't have any ID, trying to get them signed up for their Social Security, trying to get them secure benefits that the patient or the facility haven't known how to do because the patient didn't have any ID or a way to secure or find out if they had benefits to be able to get.
Well, one individual that you and I worked with together, he actually had come here as a teenager from Mexico, established a resident alien status, and had worked for many years, and then sometime in his mid years, due to mental health issue, ended up going out on the streets, became homeless, ended up at our Haven for Hope, which is a big homeless shelter here, but had no ID whatsoever, ended up with some medical issues. They admitted him to one of the local hospitals. He got there, they realized he's incapacitated. If someone is in a hospital and they're incapacitated, they can't check themselves out after treatment. So the hospital was stuck with them, but yet they needed to find some way to get a guardianship. Well, we had to identify the individual first, so we had to go through getting fingerprints done to establish who he was, and then we had to file for a green card to reestablish that he was eligible for benefits, which would be Social Security and Medicaid. That took a lot of time and effort, and actually reaching out to some politicians to make it happen.
Yeah, so all those things happen in the background, a lot of things that you don't see or know about, so just wanted to bring those to the forefront and get some more information out there, like we said. So thank you, Glenn, for coming today and give us a little more information on this topic. So we hope to see everybody soon. Thanks, guys.